We have tremendous challenges in public health in the interdisciplinary nature of the problems that we're facing. Whether it's climate change or whether it's prescription opioid epidemic, whether it's the AIDS epidemic in Africa, whether it's the issues around sedentary lifestyles and overeating, on and on and on. You're not going to solve that with a unitary, singular disciplinary effort. You're going to need talent across many disciplines and many schools. And that's difficult. That's challenging. It's challenging to collaborate. It's easier to work by yourself and with a smaller group, but you may not be able to tackle the biggest questions most effectively without that multidisciplinary unit. And I think a dean can be helpful in that regard, can try to change incentives to encourage big science and to encourage high impact work. To be invited to look at this job and then be offered and to accept the job is a great privilege, and I'm thrilled to work with the top quality faculty and staff of the school. We recruit some immensely talented students. So there really is a lot of opportunity to enhance the student experience, expand our research portfolios, and really consolidated some of the gains that have been made under Paul Cleary's leadership. The Yale School of Public Health is not one of the biggest schools, nor is it one of the smallest. It's sort of an average size school of public health. There's a big advantage to that. Students can get lost in the mega schools, schools with 1,000 entering students, with hundreds of faculty. That kind of environment is not right for every student. However, the smallest schools often have major gap areas in their expertise. So we're, as far as I'm concerned, just about right. Certainly we can grow, but the fact that we're not immense is a competitive advantage for us, and the fact that we're not tiny is also a competitive advantage. We can increase diversity, whether it's gender, racial, ethnic, sexual preference, international versus domestic. There are many layers of diversity. I believe that the more diverse an environment, the more learning opportunities there are. Yale School of Public Health is one of our august institutions in our discipline. I think it's about 102 years old. It was one of the original schools of public health founded in the United States. It's in a very interesting part of the country, in a medium-sized city with a large rural catchment area. It's both part of New England and it's also part of the tri-state area, so it relates to both population spheres, which are really quite different from one another. Yale's had a tremendous international portfolio over the years, one of the first universities to get deeply involved in China. That dates 100 years ago. And we really feel like Yale's tradition in public health has been very distinguished. I'm not an administrator who thinks that the raison d'etre is my own enhancement. I feel like I should be a servant to the needs of the school, and I hope I maintain that attitude. Paul Cleary has been a prince of a leader, much beloved and very effective, and I hope to follow in his footsteps.